Hello, I'm Dr. John Staley, president of Your Home Team Care, and I hope you're going to have a great holiday season with Thanksgiving and Christmas coming up. Some of you who are taking care of your parents or grandparents or loved ones get to see them only once or twice a year. And some of the characteristics you want to look for in an aging elder that may tip you to the point that they are declining, which we all do, that may indicate they need some care, is the following. First of all, when we watch elders during the holiday season, particularly Thanksgiving and Christmas, the first thing we notice is how they may sit down to the dinner table. So one of the first things you may want to know is their strength declining in their walking. So are they having the strength enough to be alone and to be by themselves and to walk? Secondly, what's their gait like? Is their gait steady? You might want to do the old heel to toe thing, not that you want to make them do it, that the police people do with folks, is to see what their balance is. Thirdly, can they do finger to nose, finger to nose? So there are some things you can do to evaluate some of their skill sets physically. Secondly, what kind of speech do they have? Do you notice that one of your loved ones, parent or grandparent, is slowing down? Is the speech slurred? Are they forgetting? Secondly, are they forgetting thoughts to completion of sentences? Thirdly, do they have just sometimes stop in the middle of a conversation and you think, well, they're just having a little problem. Some of these problems or these symptoms may be leading to other diagnoses, for example, dementia. Thirdly, you may want to look at the attitude of the parent, the so-called demeanor. If you've had a loved one that's been a parent, a grandparent, and they've been very polite, quiet most of their life, smiling, and all of a sudden you see them agitated or somewhat combative, perhaps on a conversation, and you just feel a little bit uneasy about. That could be other symptoms that there's something not only mentally going on, but possibly physically. So watching changes of behavior. We talked about changes of speech. We talked about physical walking. These are symptoms and signs of an elder that's aging. It does not mean they're not great people. What it does mean is you have the responsibility, we all do, because we become like our parents to us. We become the parent and they become the child. So we have to do the proactive right things to help them live where they want to. So maybe they're great at home, and we believe most people since COVID want to live at home. Because during COVID, when people passed, they couldn't get out of skilled nursing or assisted living. So again, what companion home services, or our case, we are the only physician nursing managed companion personal care in the United States. So we're able to assess these things with our RN rounding and be a much more of a value-add service than a normal business entity that's just putting a provider out to care for people. That's why your home team care is a little bit of a niche, like Kenny Chesney and Jimmy Buffett. We ain't all country, we ain't all pop. We can do a lot more from a healthcare providing standpoint because of our physicians, RNs, and LPNs to assess your parent and loved one and what they may need. So again, one of the things that gets elders puts them in a really uncomfortable position to be in a survival rate is when they fall and fracture their hip. Because hip fractures really are a physical challenge for elders, and often they can't undergo the surgery, which leads to other outcomes. So I would encourage you to evaluate or look in your parent and say, is this person able to be by themselves? 2, what kind of support do they need? Now, a lot of parents do that. And then we also offer respite care. Respite care means when you're going on vacation and maybe you're taking care of a parent at home, you need 36 or 48 hours of coverage. Well, that's what we also can do. So your home team care provides anywhere from 2, 4, 24 hours a day to certain respite care, to certain temporary solutions, going to doctor's offices. We can provide a transportation turnaround. So we're hoping you guys, all of you will have, and ladies will have a wonderful Thanksgiving. It's awfully wonderful. I know, from having awesome parents, you can't take anything for granted. They're not always going to be there. And so you really need to appreciate the time, and also, but be like you're a parent now and they're children. So you've got to have the responsibility and accountability to hopefully make right decisions. So I hope this helps. And again, I hope everybody has just a wonderful holiday season. Merry Christmas. Be sure and eat some black-eyed peas for New Year's Eve, and have good luck next year. Thank you, and have a good time.